Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, September 16th, giving you the update from Albany Med. So Fred, I see you're in scrubs. You were down rounding in the OR.
That's right. I was down in peri-op. Periodically,
Yes.
I'd like to go to places that I don't spend a lot of time in and see what's going on.
I'm sure they were glad to see you.
They were.
Let's pop open the first graph here. These are cases in New York State diagnosed with COVID. You can see that number is 2,424. I would think, looking at that graph, you would agree with me, Fred, it seems relatively flat.
It is. It has been, looks like, for about 2 weeks now, right?
Let's pop open the capital region. These are the 8 counties of the capital region, and that number currently sits at 145. And I think similarly, you can see that that seems to have plateaued. Next graph is inside here at the medical center. We have admissions and discharges. And I think what we're seeing here is somewhere between 4 to 6 or 7 admissions per day, typically balanced out by discharges.
That's right, Dennis.
Okay. So what does that mean from a morning census here on the medical center? So we'll pop open the last graph. There's 36 in the hospital, 23 are on the floor, 13 in the ICU, 5 of those are on ventilators. Fred, in the last 7 days, we've admitted 28. That compares to the week before, where in 7 days we admitted 30. How are we doing with pediatrics?
So, Dennis, today we have 3 children in hospital. Yesterday we had 5, so a couple children went home. We've seen 3, 4, 5, as many as 7 children in the hospital here in the last month or so. Okay. So that's a consistent issue for us.
Let's talk about boosters. People will stop me in the hall. They'll email me. I'm sure they do the same to you, Fred.
They do.
Is there any
do.
update on boosters?
There is, Dennis. So Pfizer had petitioned the FDA to be allowed to offer third dose boosters, and that's actually going to the FDA panel tomorrow.
Okay.
So having looked at both what Pfizer submitted, at least the executive summary, and the FDA's analysis, it's kind of interesting. So Pfizer's pretty consistent in saying that we think people need boosters. The FDA folks that reviewed their data were kind of neutral in their report. So we'll see what happens tomorrow.
All right, so we'll update that next week.
Next week.
So speaking of vaccines, obviously those that are paying attention to the news, especially those who work in healthcare, know that it was 2 days ago, there was a federal judge who came out with a ruling which essentially, Fred, it challenges the state's ban on religious exemptions.
That's right, Dennis.
And obviously on this campus, like other campuses, we've had people who've applied for and requested a religious exemption. So the one specific question I have for you today, Fred, is what does this ruling mean on this campus here?
So Dennis, we're going to pend any decision on religious exemptions until we get further guidance from the courts, frankly.
Okay. So pending, meaning we're going to put off that decision till later.
Exactly. That's right.
Do we know when we're likely to have a final decision on this legal case, have they said?
So Dennis, I think arguments are due to the judge by the 22nd, and he's going to have a hearing later this month. This will be something I think that will work its way through the courts literally over weeks to months.
Okay.
So probably not too soon.
All right. So obviously we'll update that in the near future when we have more information. Fred, as people know, we've been having regional calls really now for over a year and a half with all the hospitals in the region, specifically when it has to do with how to deal with COVID. And we've obviously talked about that many times on this video. Today's call was specifically about an issue of staffing.
That's right.
Again, anybody who's been watching the news, reading the newspaper knows that there are issues really with staffing hospitals throughout the entire country. And there's a couple points that I want to make. I'll make them, give you a chance to react to what I believe are some of the things that we need to know about this. First of all, when it comes to challenges with staffing hospitals, this is not an issue for Albany Med alone. This is not a problem for the region alone. This is not even a statewide issue. This is, in fact, a national issue, and I think that's true.
That's right, Dennis. It's absolutely true.
You've been talking to people from the state, and they can give you a view across New York State and bordering states where they're dealing with this issue.
That's right. I've actually talked to the CEO of Bay State in Springfield, Massachusetts. They're facing the exact same issues we're facing.
We focus a lot about nursing, obviously, because the nurses are so critical, delivering care at the bedside. I think it's fair to say that this staffing crisis, and I don't use that word lightly, is not just about nurses alone. In point of fact, Fred, you run the hospital. You would list any number of positions where there are challenges out there finding individuals to fill roles. And I think that's something you...
Again, Dennis, that's absolutely true. Laboratory technicians, echo techs, ultrasonographers, rad techs, respiratory therapists, pretty much any group, any staff group we have, we're having difficulty finding enough people.
The third point is this issue of staffing predates this last month or two. It's something that's actually been happening now for several months, really, and one could even go back and probably look at data that would suggest it's been happening longer than that. It is a complex issue. There's a lot of factors behind it. But the point I guess I'm making is we didn't wake up today and say we have a staffing issue. We've been thinking and looking at this for quite some time now.
So, Dennis, I took the week off of the 4th of July, and when I came back, we started talking about how we were going to manage given our staffing at that point. So we have been focused on this literally for months.
The fourth of 5 points I'll make is that the vaccine mandate that we are all living under right now is actually taking the situation and it's making it more challenging.
That's right.
But this staffing issue that we're dealing with is not just from the vaccine mandate as well. And I just want to kind of call that out because I think people may incorrectly believe that it's the mandate alone that is creating the crisis, and it is much more complex than that.
So I think, Dennis, the mandate has pushed us a little bit further, frankly pushed us over the line in terms of the staffing issue.
Okay. The last point I'll make is unique about this campus. So the last 4 topics I hit on were all broad themes, really national issues. We are the area's only regional trauma center, the area's only academic medical center, the area's only children's hospital. There's a whole number of things that we provide that service. Fred, we have a unique role within 25 counties and beyond.
That's right.
I know you and I and others are spending a lot of time looking at this staffing crisis, and one of the things that we're working hard to do is be sure we preserve our unique role in this region and things that we can provide that can't be provided at other hospitals.
That's absolutely right, Dennis, because if we can't provide those services and no one else in our region can, frankly, I don't know what happens with those patients. A trauma patient has got to come to a trauma center, and that's us.
Okay, so thought it was important today just to spend a couple of minutes talking about the staffing issues nationally. I think this is a topic we'll definitely talk about again.
We will.
Fred, one thing we do know is that we provide the best care in the region, and the reason we do is because we have tremendous staff. We have highly qualified individuals. We can't deliver that care if they're not here with us delivering that care. So recently, we rolled out something called PEP, which is really something which we believe will hopefully allow us to deliver more care. What is PEP?
So, Dennis, PEP stands for Pay Enhancement Program. And it's a way, it's kind of twofold, Dennis. So for those people who regularly come and do all their shifts if they're full-time, it's a recognition of that and it's rewarding them.
Yes.
And for those who sometimes, perhaps for various reasons, don't fulfill that commitment, that full-time commitment, it's an encouragement to not call out, to come in on a day when perhaps they might be on the fence about whether they're going to come in or not.
Okay.
So it's extra dollars. It's $250 for full-time folks, and for 0.9 people, it's $200 per pay period. It went into effect this pay period, so starting Sunday of this week through the end of next week, that pay period, and will continue through the end of the year.
Yeah. For sure. And if you're watching this video, we've sent out messengers, of course, about this. There's been things on the intranet. If you're unsure about it, please talk to your manager, and they can explain a little bit more to you about that. There's thousands of members of our workforce to whom this applies.
Absolutely, absolutely. Right. And Dennis, I'd say one more thing. It's also an encouragement to those people who aren't full-time to become full-time.
That's right.
So if you're a 0.7 or a 0.8, think about becoming a 0.9 or a 1.0. For us to increase the ranks of our staff, that's the easiest way for us to do it.
So Fred, if you had an employee who said, you know what, I don't know if I can commit to becoming a full 1.0 forever, but I'll do it for the next 3 months, you would say?
Thank you very much.
Okay.
Please do it.
So even in the short term, they would qualify for the PAP?
That's right.
Okay, very good.
That's right.
All right, well, mostly to those individuals who are providing care every day, we thank you. There's no question, again, unique role in the region, best care, and we need you, and we thank you for being there.
And the best staff.
And the best staff, for sure. Anything else on the list?
I don't think so. I think we covered it.
All right, well, we hit a lot of topics. I'm sure we'll pick a lot of them up again next week. Sounds like there's some issues that are in flux, and so we'll talk more about it next week. All right, to those who are working here this weekend, we thank you very much.
Thank you.
And to those who are taking the time off, we hope you get some well-needed rest. We'll be back again next week. We once again ask that you please take care of yourself, take care of each other, and we'll see you next week.